CICU devices.
Intraaortic balloon pump, consoles and catheters. The Iabp family. For more insights on intraaortic balloon pump, we invite you to visit our Iabp Guide playlist on the CICU Devices channel. The intra-aortic balloon pump remains the most widely used form of temporary mechanical circulatory support worldwide. It continues to play an important role in the management of selected patients with cardiogenic shock, high-risk percutaneous coronary intervention, and perioperative hemodynamic instability. An Iabp system consists of two main components: a balloon catheter and a pump console that controls balloon inflation and deflation. Over the past decades, Iabp technology has evolved considerably, with continuous refinements aimed at improving ease of use, reliability, patient safety, and hemodynamic performance. Although the fundamental principle of counterpulsation has remained unchanged, major advances have been achieved in both console technology and catheter design. Today, only a few manufacturers remain active in the intra-aortic balloon pump market. The two leading companies are Teleflex, through its Arrow product line, and Getinge, which continues the legacy of Datascope and Maquet with the Cardiosave platform. Teleflex and Getinge are the dominant manufacturers in the global Iabp market, although several other companies, such as Senko Medical, Tokai Medical Products, and Xeon Medical, remain active in selected regional markets and specialized applications. Modern Iabp consoles are compact, portable platforms designed for use in intensive care units, catheterization laboratories, operating rooms, and during inter-hospital transport. Current consoles incorporate advanced automatic timing algorithms capable of synchronizing balloon inflation and deflation using either the electrocardiogram or the arterial pressure waveform. The latest generation consoles also support fiber-optic arterial pressure sensing through compatible balloon catheters, enabling direct, high-fidelity aortic pressure monitoring and further improving timing accuracy. These algorithms continuously adapt to changes in heart rate and rhythm, minimizing the need for manual adjustments and maintaining optimal counterpulsation even in the presence of arrhythmias. Modern systems also support pacemaker triggering, backup operating modes, internal battery operation, and transport-ready configurations to ensure uninterrupted therapy across different clinical settings. Additional features include high-resolution touchscreen displays, integrated hemodynamic monitoring, comprehensive alarm management, and intuitive user interfaces that simplify device setup and bedside operation. Teleflex currently offers two Iabp consoles, the AC3 Optimus and the AC3 Range, both incorporating the autopilot and intra-beat technologies for automatic trigger selection and balloon timing. These algorithms continuously synchronize balloon inflation with the dichrotic notch and deflation immediately before systole, maximizing diastolic augmentation, enhancing coronary perfusion, and reducing left ventricular afterload. Both platforms are compatible with Teleflex fiber-optics catheters, enabling direct fiber-optic measurement of central aortic pressure. The AC3 Optimus is Teleflex's flagship Iabp console and remains the company's most widely used platform in clinical practice. More recently, Teleflex introduced the AC3 Range, a compact, lightweight, and rugged console specifically designed for patient transport. Optimized for use in ambulances, helicopters, and fixed-wing aircraft, it provides uninterrupted hemodynamic support during inter-hospital transfers while maintaining the same automated counterpulsation capabilities as the AC3 Optimus. Getinge, in turn, offers the Cardiosave Hybrid and Cardiosave Rescue consoles. Unlike two completely independent platforms, both consoles are integrated into a single convertible architecture, allowing the transport-oriented Cardiosave Rescue to dock seamlessly into the Cardiosave Hybrid docking station. The Cardiosave Hybrid is intended for routine hospital use while remaining fully transportable, whereas the Cardiosave Rescue is specifically engineered for mobile critical care transport, including helicopter and ambulance environments. The Cardiosave Hybrid is designed as a versatile console for both bedside use and intra-hospital transport. It combines the functionality of a full-size intensive care Iabp with the portability required for patient transfers between the catheterization laboratory, operating room, intensive care unit, and imaging departments. The Cardiosave Rescue is specifically engineered for inter-hospital transport and emergency retrieval. It is substantially smaller and lighter than previous Maquet consoles, facilitating use in ambulances, helicopters, and fixed-wing aircraft. The disposable Iabp catheter has also evolved considerably in recent years. Modern catheters are manufactured using highly flexible, biocompatible polyurethane materials with low-profile designs that facilitate percutaneous insertion while reducing vascular complications. A major technological advancement has been the incorporation of fiber-optic pressure sensors at the catheter tip. This technology provides high-fidelity central aortic pressure monitoring without the damping and lag commonly observed with conventional fluid-filled systems. Continuous real-time pressure acquisition also improves automatic timing accuracy, particularly during arrhythmias or rapid hemodynamic changes. Iabp catheters also vary considerably in design. Common differences include balloon volume, shaft profile, insertion size, tip configuration, fiber-optic versus fluid-filled pressure sensing, and available sheath compatibility. Complementing the Teleflex Iabp consoles is the Arrow intra-aortic balloon catheter portfolio, which offers a broad range of catheter configurations to accommodate different patient anatomies, vascular access conditions, and clinical requirements. The Arrow product line comprises several catheter families, including Ultra 8, Ultra Flex, ReadyGuard, and fiber optics, each offering distinct design characteristics tailored to specific clinical scenarios. The Ultra 8 is an 8 French intra-aortic balloon catheter designed to provide an optimal balance between deliverability and mechanical performance. It is available in 2 balloon volumes, a 30 milliliters model recommended for patients shorter than 162 centimeters, and a 40 milliliters model intended for patients between 162 and 182 centimeters, according to Teleflex sizing recommendations. A large central lumen enables fluid-filled arterial pressure monitoring, providing a high-fidelity aortic pressure waveform while minimizing the risk of lumen clotting. The fiber-optics Iabp catheter incorporates an integrated fiber-optic pressure sensor located at the catheter tip, enabling direct measurement of central aortic pressure. The real-time aortic pressure signal enables the Teleflex intra-beat algorithm, which automatically optimizes balloon inflation and deflation on a beat-to-beat basis. The fiber optics catheter has an external diameter of 8 French and is available in 3 balloon volumes, 30 milliliters for patients shorter than 162 centimeters, 40 milliliters for patients between 162 and 182 centimeters, and 50 milliliters for patients taller than 173 centimeters. The UltraFlex Iabp catheter is specifically designed to facilitate advancement through tortuous or challenging vascular anatomy. Its most distinctive feature is the incorporation of reinforced coiled shaft, which provides superior flexibility while maintaining excellent resistance to kinking. The catheter is available in 3 balloon volumes to accommodate different patient sizes. The 30 milliliters and 40 milliliters models have an external diameter of 7.5 French and are recommended for patients shorter than 162 centimeters and between 162 and 182 centimeters, respectively. The 50 milliliters model has an external diameter of 8 French and is intended for patients taller than 173 centimeters. The ReadyGuard catheter is designed to minimize vascular access complications while maintaining excellent hemodynamic performance. Its low-profile design allows the 30 milliliters model to be introduced through a 7 French sheath, making it one of the smallest intra-aortic balloon catheters available. The 40 milliliters and 50 milliliters models are also available, with an 8 French catheter shaft, providing greater balloon volume. A distinctive feature of the ReadyGuard catheter is its braided stainless steel central lumen, which enhances shaft stability, improves torque transmission, and increases resistance to kinking without compromising flexibility. The following table presents a comparative overview of the Arrow Iabp catheter family, including balloon volume, catheter size in French units, and the recommended patient height for each model. On the other hand, Getinge Iabp catheter portfolio offers a range of catheter designs tailored to different patient anatomies and clinical requirements. The portfolio includes both conventional fluid-filled and fiber-optic pressure monitoring catheters, available in multiple balloon volumes, and catheter profiles to facilitate individualized device selection. The Getinge product line includes different catheter families: Linear, Mega, Sensation, and Sensation Plus. The linear fluid-filled Iabp catheter is Getinge's standard intra-aortic balloon catheter designed for routine clinical use. It incorporates a conventional fluid-filled lumen for central aortic pressure monitoring. The catheter has an external diameter of 7.5 French, offering a balance between ease of insertion and effective hemodynamic support. The linear catheter is available in 3 balloon volumes to accommodate different patient sizes. A 25 milliliters balloon for patients shorter than 152 centimeters. A 34 milliliters balloon for patients between 152 and 162 centimeters. And a 40 milliliters balloon for patients taller than 162 centimeters. The Mega Iabp catheter is designed to provide enhanced hemodynamic support through the use of larger balloon volumes, making it particularly suitable for taller patients or those requiring greater diastolic augmentation. Like the linear catheter, the Mega series incorporates a conventional fluid-filled central lumen for continuous aortic pressure monitoring. The Mega catheter is available in 3 balloon sizes. The 30 milliliters model is intended for patients shorter than 152 centimeters and has an external diameter of 7.5 French. The 40 milliliters catheter is recommended for patients between 152 and 162 centimeters, with an external diameter of 7.5 French, while the 50 milliliters version is designed for patients taller than 162 centimeters, with a diameter of 8 French. The Sensation Iabp catheter is Getinge premium fiber-optic intra-aortic balloon catheter, specifically designed to combine a low-profile shaft with advanced hemodynamic monitoring. Its most distinctive feature is the incorporation of an integrated fiber-optic pressure sensor located at the catheter tip, enabling direct measurement of central aortic pressure without the limitations of conventional fluid-filled systems. The Sensation catheter is available in 2 balloon volumes. A 34 milliliters model recommended for patients shorter than 162 centimeters, and a 40 milliliters model for patients taller than 162 centimeters. Both catheters have an external diameter of only 7 French, making them the smallest Iabp catheters in the Getinge portfolio. The Sensation Plus Iabp catheter is designed to provide enhanced hemodynamic support by combining larger balloon volumes with integrated fiber-optic pressure monitoring. Compared with the standard Sensation catheter, the Sensation Plus features larger balloons, allowing greater aortic blood displacement during diastole. The Sensation Plus catheter is available in 2 balloon volumes. The 40 milliliters model is recommended for patients shorter than 162 centimeters, whereas the 50 milliliters model is intended for patients taller than 162 centimeters. The following table provides a graphical overview of the Getinge Iabp catheter family, summarizing the available catheter models, together with their balloon volumes, catheter diameters in French, and the recommended patient height for each configuration. In conclusion, despite differences in user interface design and proprietary software algorithms, both Teleflex and Getinge systems provide comparable clinical performance and are effective platforms for temporary mechanical circulatory support. In clinical practice, the choice between them is generally driven by institutional experience, local availability, clinician familiarity, and integration with existing critical care workflows, rather than by significant differences in hemodynamic performance.
If you've enjoyed our video, please press the like button and subscribe to support us so we can continue creating quality content like this.